Good afternoon. I'm Talitha Vickers. We are hearing directly from Forsyth County Sheriff Bobby Kimbrough about cases of COVID-19 at the detention center. The sheriff says 68 tests have come back positive out of 575 conducted to date. That's a percent positive rate of 12%. Sheriff Bobby Kimbrough says that every inmate is given 2 masks and has access to hot and cold running water, soap, as well as towels. He adds that no inmate has been transferred or released because of COVID-19.
The tests are coming back every day from the results, and we're doing precautionary measures to stop the spread.
The Triad Abolition Project is pressing the sheriff's office to meet multiple demands, including releasing low-level offenders, the elderly, and people with health conditions. The latest numbers of the North Carolina Department of Health and Human Services currently show positive COVID-19 cases for 11 staff members and 37 inmates. Now, these numbers will be updated tomorrow afternoon by 4 p.m. After weeks of negotiations, more COVID-19 relief is coming. Congress and the White House have reached an agreement on the emergency federal relief package. The House and Senate will vote on the nearly $900 billion relief bill today. Here are some of the highlights for you. $286 billion will go toward direct economic relief. This includes an extra $300 a week in unemployment benefits. That would last through March 14th. It would also include up to $600 in direct payments for people making up to $75,000 a year. People with children would get $600 per dependent child. $325 billion earmarked now for the Paycheck Protection Program. This is a program that helps small businesses by providing them with forgivable loans. $52 billion will help provide vaccine distribution and testing measures. $82 billion for schools, $25 billion for rental assistance.
It is a good bipartisan bill. It does, as different from bills that have been proposed on the Senate side by the Republican leader, it does things that his bill never did, and that is it addresses the food needs of the American people. Maybe 15 million children are food insecure in our country, and adults as well.
There is also money set aside for food aid, child care, and the Postal Service as well. Well, today, Governor Roy Cooper will witness COVID-19 vaccinations in person at Duke University Hospital in Durham. The frontline healthcare workers will get the Pfizer vaccine. Moderna's COVID-19 vaccine is being shipped across the country right now. FedEx and UPS are loading up trucks to transport the vials to healthcare facilities. Officials with Operation Warp Speed say 5.9 million doses of the Moderna vaccine will be shipped on Monday, with the first shots likely administered that same day.
It's a sense of pride, a sense of excitement. We could stand here for days and talk about all of the stories and just how, proud all of the team members feel for being able to participate in this historical moment and really, help bring a sense of hope.
Historical moment indeed. Well, CVS Health will begin administering COVID-19 vaccines to long-term care facilities next week. Now, starting on December 28th, CVS will begin administering the vaccine in nearly 900 skilled nursing and assisted living facilities in the state of North Carolina. The CVS team will then make 3 visits to each long-term care facility. Majority of the residents will be vaccinated 3 to 4 weeks after the first visit. President-elect Joe Biden and incoming First Lady Dr. Jill Biden will receive the first dose of the Pfizer COVID-19 vaccine today. Pfizer's vaccine requires 2 doses administered several weeks apart. That's so that the vaccine can reach 95% efficacy. Biden's transitional team says that Vice President-elect Kamala Harris and her husband Doug Emhoff will receive the vaccine next week. Adults 75 and older, along with frontline essential workers, should be first in line to get the next round of the COVID-19 vaccine. That's the recommendation from a CDC advisory committee. Phase 1B includes first responders, teachers, and corrections officers, along with postal workers, public transit workers, farmers, and grocery store employees.
Obviously, we all wish we had all the vaccine in the world, that we could get everybody vaccinated immediately. But I think this tiering saves lives, probably does the best on reducing transmission.
For Phase 1C, the CDC suggests prioritizing adults ages 65 to 75, people with pre-existing conditions, and other essential workers. Initial vaccine doses are already going to residents in long-term care facilities and healthcare workers as well. Here in the Triad, Randolph Health is beginning to treat low-level COVID-19 patients today. The hospital says patients with the virus will be placed in negative pressure rooms throughout inpatient units. No visitors will be allowed for COVID-19 patients. The hospital says that it will designate one family member to be a point of contact for that patient. They will also use additional iPads and tablets to improve communication.